welcome everyone with this at this OHBM Student and Postdoc SIG workshop. I'm going to give a short introduction. My name is Debbie Klooster and I'm part of the Student and Postdoc Special Interest Group. And together with Elisa, who is also part of this SIG, we are hosting this workshop. I have a small number of slides to quickly introduce what the SIG actually does. So I will quickly share my screen. One share screen. Let's see. I think. Share. I think you should be able to see my screen now. All right, yeah, perfect. So we are the Student and Postdoc Special Interest Group of the OHBM, and what we actually do is we provide help, support, advice, and guidance in all sorts of ways to, well, basically PhD students and postdocs on their professional career, but also on their personal career. If they want to have extra advice, they want to talk to peers, we can link them or help them and, well, at least try to guide them in the right direction. And this is the team that we're currently working with. So these, the upper part, are the current members of the SIG, and these are the elect members. So we will take over. Basically, this year we will learn all about it, and next year we will be the actual committee. As part of the committee, when OHBM is almost approaching, one of the things we do is we organize workshops. The first one already kicked off and was last week. There was the first ever workshop in Mandarin, so for Chinese people. I don't have to tell you a lot about today's workshop, who's going on. It's going to be about alternative academic careers. And we will have another one on science communication next week on Monday. Oh, these are in more detail. And then during the conference, we will also have a symposium on re-envisioning the future of academic training on Wednesday. And there is a roundtable on June the 21st, so on Tuesday. And you're all very welcome to attend these parts. So I think that's it from my side. Then for today, we will talk about alternative career options. I think this is very relevant for everyone who is in academia. Personally, I'm very happy in academia, but there's always a thing of funding. So you never know if you can continue within academia, if you want to continue within academia. So it's always good to explore your options and to know what is beyond, what's possible beyond academia. So today we have two speakers. We have Bas Neggers and we have Maarten Versluis. And I think part of their presentations will be to introduce themselves and their career path. So I think I will stop talking and just give the floor to, let's ask Bas first, to tell about his experience and his career path up till now. Let's see, should I stop sharing? Yes.
It says the host disabled sharing. So
uh-oh.
Maybe someone should enable it.
I am the host. Let's. Where do I enable that?
I think next to share screen, there should be an arrow that you have to click and then advanced sharing options or something like this.
Yeah. Oh, wait, yeah. I think if you try again.
Yes, that looks much better.
Okay.
And there was this thing with Zoom, when you use PowerPoint, at first have to start and then click share, otherwise it's not working, I recall. Let me try. Okay. Yes, indeed. Right, can you guys see this?
Yes.
Great. All the webinars during the pandemic helped getting better at this. Okay, guys, thanks for having me at this wonderful workshop. I'd love to share my experiences with you. Some apologies up front. I catched COVID over the weekend. I'm recovering now, but my voice is still a mess. So I usually don't entirely sound like this. But yeah, otherwise, okay-ish. So I used to work, I did my PhD at the Max Planck Institute in Munich in Germany. After that, I went to Utrecht University in the Netherlands for my first postdoc of 4 years. And after that, I got a really good offer from UMC Utrecht to become a staff member in the brain division over there. My background is, by the way, biological physics and medical physics. My PhD was in neuroscience. So there I stayed until the associate professor level. But as always, I had an interest in a core interest in working and doing research and innovation outside academia. I think ever since I was a PhD student. So it's not something I did to have as a backup when academia doesn't work out, because for me it didn't work out that bad. I actually had a group of 10 people at some point. Well, grants are hard, but I got some every now and then. So it's not that my funding dried up, but it's something that was intriguing me like for a long time, to do innovation in your own organization. Well, really be your own boss in a way, because even as a professor, you're not really. So that was a desire I had for a long time. And then a good opportunity came along in the person of the Knowledge Transfer Organization, the KTO of Utrecht University. They saw some technology we developed in my neuromodulation lab, and there was an interest in the market, in the clinical market for that. So we decided to found a startup 11 years ago. The first 2 years, it was just something on the side, like me and a few colleagues did besides our academic work, but it grew. We got some more funding. So that's where this story starts. So I want to tell you a bit from startup to scale up. So the story I'm going to share with you guys is more about how to do a startup, and maybe how to not do a startup, if you're interested in that. And after that, I'm open for questions and debates on why should you want this or not want this at all. I still have an honorary position. I do still do some teaching and supervision at UMC Utrecht, but that's fairly limited. But it keeps the connection open. That's always good. I really cut ties and burned ships behind me 2 years ago, and I quit at the UMC Utrecht. So I quit the tenured position to do this, not because I couldn't get one. So that's me. No, it doesn't. Here we go. So who is our company? We're small, but growing. I said founded in 2011, something we did on the side for my study. But later we moved to an incubator, and even after that to this lovely estate that we're now in, right next to Utrecht University campus. We have about half of the first floor by now. So the premises are at Landgoed Oostbroek, also physically next to the UMC, but we also still have strong ties with UMC Utrecht, and half of our staff originated there too. The shareholders are the Utrecht Holdings, KTO of the Utrecht University, myself, and an angel investor that also has been CEO for a while, Ms. van Meegen, an experienced director from the pharmaceutical industry who helped us grow. Can you guys still understand me? Interrupt me if something is not clear or when you can't understand me. That's perfectly fine. In 2013, we got on the market, as they say, in the medical device industry, with a certified quality management system and CE marking in the European Union for medical sales. A few years later, the FDA clearance followed. By now we have several CE certified and FDA cleared products on the market. I'll tell you more about it in a bit. The Health Canada and Australian approvals are in, and the Korean FDA is pending. So that's an important factor here, the market registrations. We have 11 worldwide distributors, also really huge, well, we are a global player, but it's a specialized market. So it's a bit over 160 installations in hospitals and labs worldwide that we manage to sell. So that's roughly who we are. We have an experienced team of 8 core employees, most of them full-time. We have a couple of consultants that also are very present. I didn't list them here for time's sake. Some of you might know Jocht, who also is finishing his PhD. And yeah, so we are mainly a software company. We use some hardware. We have regulatory, customer care, and sales. So you can visit our website to find more about our team. What do we really do? Well, the name of the company gives it away a bit, BrainScienceTools. So we bring mainly software to market to use in neuronavigation and neurostimulation. And we also give training and courses around that. And we distribute TMS and EMG of an important business partner. So for those of you who are not familiar with it, non-invasive brain stimulation in the form of TMS or transcranial magnetic stimulation is a technique where you place a big set of 2 coils on the scalp, and by discharging a strong current through these coils, you can evoke a focused magnetic field at the intersection of both coils in the brain. And for example, I can make your fingers move or make you stop talking briefly. It's a nice focal manner to intervene with processes in the brain. This is used for diagnostics and also for treatment of several brain disorders quite successfully in neurology and psychiatry, mainly major depression, but also it's used during rehabilitation for stroke and other conditions. It's used to explore deficits in the brain before neurosurgery, and a couple of more by now established medical applications of this neuroscience technique. I've been active for about 20 years in this field as a researcher initially. I always had a focus on applications and methods, so that came in handy when starting a company. So you really need something, of course, to sell in the end. That's important to memorize here. So on the left, you see an older version already of our software, where we show how you can guide a coil on the screen in real time to a target in the brain using an MRI. So we make this technique much more precise and reliable with our software. The complete setup we sell is shown on the right, one of the setups. We have quite a few. It's an RTMS treatment setup with a navigation system integrated. We developed a medical treatment chair and many more accessories. Not all of them are shown here. Yeah, that's basically the setup we market. The stimulators and EMG itself, we purchase elsewhere. So we also distribute a range of products from Neurosoft, one of our important business partners around the world, which is RTMS, monophasic TMS, and several EMG devices and accessories. So we have new applications that we released more recently. So we, of course, have been researching and developing a lot, not less than in academia, to be honest. So we now also can map the motor cortex. Those of you who are neuroscience will know what it is. So you can show the muscles on the top of your brain surface, where they're controlled from, by measuring electromyography of your muscles during brain stimulation. This is used to explore recovery during rehabilitation after stroke, and also to plan surgical interventions. So it's even a more niche market, but these setups are even more expensive. So that's still quite interesting for a small company. So far now, I want to give you some advice. For those of you who have the startup vibe, and these days many innovations do happen in startups. I was really in doubt whether I should wear this T-shirt. Maybe you can read it. But I thought, yeah, this is a fancy organization, so maybe I should not dress in the way we dress at our startup. So if you are interested to become your own boss and found your own company, maybe with colleagues, there definitely are many options. It really will depend a bit on your field, whether it's suitable or not. But you should really don't do it lightly. So don't think about a startup because you think, okay, I want to stay in academia, but my chances are limited. Funding is hard. So I would advise that you have an intrinsic interest to do this. So it's different from science. There's overlap, of course, as well. But yeah, the truth has to be said that the majority of startup fails. It's about 8 out of 10 or so that fails in the first few years. So it's I don't want to discourage you, but think and plan well. That's really important. So your proposition, what are we selling and how? Your team, crucially important. Who are your co-founders? Who are your team members? Do you think you can make this journey with them for a long time, because it will take time, especially in the life sciences. Is there a market fit? Is there a market at all? So in other words, does someone wants to buy my shit? So that's really what you want to know. So every researcher really likes that topic, but don't be a fanboy or fangirl. Explore it well, maybe at an incubator scheme. So there are training and pressure cooker schemes at most universities' incubators, where you can try out your idea, often free of cost, to see if it's, and you get good supervision. First find out, is there a market? So is this viable, my idea? Some ideas are, others are not. You better find out early on. It'll save you a lot of time and money. Don't underestimate legal and regulatory affairs. I thought I had a realistic view, but it was 3 times as bad. So it's, especially in the life sciences, medical registrations like CE marking for medical use, FDA clearance, etc., for different regions are crucial. Without that, you simply don't have a market, or a really tiny one, and you won't make it. Your intellectual property, so everything you did in research before you start your company most likely is owned by your past employer or employers, so you need to make arrangements for that. That's crucial. Do you want seed capital? Yes or no? Well, we decided not to go with VCs. Later, I might have regretted that a bit because it's the hard way. But you still will own most of your company after years of being in business. So starting with VCs is fancy in the beginning and comfortable, because you might, if you have a good idea, you might get a lot of money when you pitch to investors. But they often want 90% or more of your company in exchange, so you'll lose control. But you'll probably can exit within 3-4 years with a nice profit if you're lucky, or they'll completely squeeze you and you end up completely broke. So these people are tough. So they're nice, they have a lot of money, but they are demanding. And while you're at it, so I might have scared you a bit, have some fun. So that's, as in science, you only should do this if you really want it, if you enjoy it. So that's the same thing as in science. So legal and regulatory, as I stressed that so much, took up most of our revenue in the beginning, and the small investment we got from the KTO and one angel investor, not a VC, but someone who joined me in the board actually. People think, I don't need it, I'll mainly sell to researchers. It's even there for your IRB proposal, it's handy. Everybody wants certified devices. So it takes a long time. You need to write down everything you do and follow strict industry standards. So this is expensive and takes time. Do it from the start. So if you develop something, take this into account right away, even when you're still in science and want to license it out at some point and start a company. Start using subversioning, make good documentation, work according to tickets. So try to do some basic things when you develop your technology, if you're a software, for example. So if the earlier you take that into account, the better. It might even be impossible afterwards. And you might have to develop your things from scratch in your academia, and you don't want that. So when that notion isn't there of the legal and regulatory pathways, with the founders or developers, things will likely become very unpleasant. So this is what I wanted to stress out if you're like me interested in medical devices or medical software even. So even the simplest heartbeat apps will need certification. So there's really no way around it. That's a warning. In a nutshell, that was what I had to say about us and our company. If you have any questions for me, my career path, I'm open to take them.
Yeah, thanks, Bas. That was a really nice story with some with some things to think about. For everyone, if there is questions, feel free to unmute yourself and ask them, or you can simply write them down in the chat, and I can, me or Elisa can read them out. So if there is already someone who wants to unmute themselves, then I would say go ahead.
Bas, maybe I can ask a question. What was for you the reason to cut the ties with UMC Utrecht? The formal ties, basically, as not being employed anymore.
Well, there were many. So my story is not the typical startup story, although I'll see them more often. So for me, it was an extremely gradual process. So in 2011, we founded our company, and it really was a side gig for me and two colleagues to make a few sales to labs we knew and fund some more research. So it was really something on the side. And I'd say after 2013, 14, it got more serious. Around 2015, I actually contemplated completely stopping, because as a founder, when you don't go full time in your company, it's not going to fly. So that's a realization you should have. So to do it gradually is fine. I did it myself. It will take longer. And yeah, the longer you work both pathways, the harder it gets. So your loyalty, conflict of interest, all these things make it harder to do that. But personally, for me, as always in life, it also depended on some coincidences. After a couple of years of not getting much funding, I got a pretty big EU grant, and also a postdoc from the US who wanted to join my lab and brought a big bag of money. So all of a sudden, I had all that money to spend at UMC Utrecht. But the group I was working in, with the departure of the big name director, was also heading in a direction that I didn't like. So basically, I set out these large grants before leaving full time. So it was an opportunity that presented itself at the time I wanted to leave. And then 2 years ago, the company was flourishing. Well, flourishing, was still small, but growing, doing cool stuff. The environment I was in academically was, well, to say politely, was not improving. So I thought this is really the time to quit. So it's not that my position was in danger or anything, but it felt like the right moment. And most of the PhD students and postdocs from the larger grants I got were finished by then. So it was also a sense of obligation towards the people I hired to make it end in a natural way for them.
Yeah, thanks.
Anyone else who wants to ask a question?
Yes.
Go ahead.
So I was wondering how you learned to run a company. Did you just learn it by doing? Did you have to invest a lot of time spend on, like, you know, reading all the regulatory affairs and you know, all the things that we don't know in academia, you know?
Yeah, some of the stuff you know, actually, maybe without realizing. Strictly speaking, at least in the Netherlands, starting a company is not that hard. So don't overestimate the process itself. So when you go to in the Netherlands, to the Chamber of Commerce, you get a number, go to notary, you can do all of that in one day. Every quarter you have to do some tax declarations, and that's it. So the minimally required stuff is straightforward. The harder stuff is getting funded, attracting the right people. And those are management skills that I find academias are not that bad at. I mean, most of them know that from their training, and they know how to get funding. It's actually much harder in academia, to be honest. Many academia have supervised, so they know how to supervise a team. The regulatory parts, I had the luck to our shareholders, the KTO. They, also as part of the investment, they provided a regulatory expert to me, free of charge, for over a year. So, and because I was still in academia, I did this initially as a side thing. I was able to learn it as I went along. If you start from scratch and leave academia right away, then I would advise you to get a quality assurance person in your team early on. But because I had time, I could learn it as we went along. So and the business part, so you really don't need an MBA. So that's I don't think you need that. A business partner that has experience in business can be handy. I didn't have one initially, but later on I did. So someone who knows the drill in business and in negotiations can be handy, and how to make liquidity prognosis and stuff like that. But for academics, it's really not that hard to, like, at least have the skills that you think you don't have, you already do. So I hope that answers your question.
Yes, and that sounds very positive. Thank you.
Maybe I had a quick question while we wait for anyone else. It sounds like there's a lot of overlap between academia and industry in terms of the skills you might be using, but I was wondering if you could touch upon maybe some of the differences in terms of maybe the pace of the work, the type of work you're doing, just to give us a bit more of an idea of maybe what drew you there.
Yeah, that's a very good question. It depends like substantially on the sector that you're in. I can speak for the medical device sector and the software field that I'm in. So yeah, as you said, the things like managing a team, doing innovations is not that different. It's more rigorous in industry. That might sound strange with all the peer reviewing and reviewer two and PhD defenses, but things are generally in my sector more rigorous. When you see people laugh about academic software in my industry, this academic software, it means it will crash and it looks ugly and no quality control. It's improving slowly, but that's I think generally true. Academics focus more on the concept, whereas in business you need to focus on the application. Well, there's not just work in my lab, but also in 100 more. There's the scale. So all these things are relevant. And you're making something for others to buy and use. So that's not just yourself. So that's a big difference. I said the regulatory regime is much, much stricter. That's a big difference. And depending a bit on your current position in academia, the base is generally high. When you run out of money, it's over. So there's no professor who might prolong your contract but these days in academia, it's pretty cutthroat as well. So I'm not sure that used to be a difference, maybe not so much anymore. When your postdoc runs out and you don't get new funding, it's over as well. So maybe that was different, but that becomes more similar these days. And it's more direct. So I think the reward cycle can be shorter than in academia. So when you investigate something in academia, it might become relevant in 10 or 20 years, if at all, in the market. Well, these cycles of reward are shorter in business. Yeah, and the focus on finances, that's of course, well, it matters in academia too, but for most of you, I guess, at the postdoc stage, that's still something your supervisor takes care of. Yeah, in the business, that's much more a direct concern. So maybe that summarizes it to some extent.
Wonderful, thank you very much.
Are there any questions from the audience? I do still have one question pending for myself, but
if not, we can take them at the end.
Yeah, of course. Let me just ask one more question. So I was wondering about your timeline. So you very clearly explained that it was a very gradual transition for you to go from academia to industry. In retrospect, would you do anything different? Would you still do your PhD? And is it like the knowledge that you gained during your PhD is apparently useful within the startup? Would you still do a postdoc, or would you say after the PhD, I'm going to be aware and make a very aware decision, like I'm going to do a startup company?
Yeah, this is a very good one, and one I've been struggling with myself recently to answer. To be honest, I don't know the best answer to that because it will really depend on your situation.
Yeah.
I would definitely try to become a known expert in your field. So, I mean, that always helps also in business. When people know your name and say, hey, this person definitely has some background in that, verifiable background, that's helpful also in business for sure. So, yeah, that probably please for not leaving academia right away if you want to do this. My path is pretty atypical, so that's I have to say up front. For the business, it would probably have been better if I left academia 5 years earlier. So that's, but for myself in person, I'm not sure. But on the other hand, opportunities, good opportunities are rare and only seldomly present themselves. So if you did something really cool during your PhD project and there seems to be a market interest and there's attention from the outside world, maybe even from VCs, then yeah, it might be the best moment to go for it. So it really depends on your situation. I don't have a clear-cut answer, unfortunately.
No, I think it is clear. You just have to see how it works for you. But yeah, at least I think it works out for you perfectly. So thank you for sharing your story. think if there are no more questions, and otherwise we can keep them for the end, we can move on to our next speaker.
Thank you for
thank you very much, Bas. Oh yeah, and you could have definitely worn that t-shirt.
Okay.
Thanks for showing it anyway.
I wasn't sure, but
no,
I'll remember.
It's all fine. Okay, let's go to our next speaker then. We have Maarten Versluis, who will share or his story from academia to his career at Philips now. So Maarten, you already shared your screen, perfect.
Yeah, I still have to find you back because you all disappeared, but you're also back. Yeah, thanks a lot, and thanks, Bas, for already mentioning a couple of things that I also going to echo here as well. Well, also thank the organization for inviting me here to this workshop. My name is Maarten Versluis, and I'm employed by Philips Healthcare as a clinical scientist, neuroscience. And that's also immediately my disclaimer. So what I'll share here has a large MRI bias. So I'll share some of the things Philips does, but all with my own MRI view on it. Going quickly through the company, Philips is of course a long-standing company. It's founded in 1891 in Eindhoven in the Netherlands, starting to manufacture lamps and other electrical products. And over these 130 years, we've been having many different innovations. So I'm just going to highlight a few, like in the early 20s, the X-ray tube. And important to what I'm going to discuss here is the first commercial magnetic resonance system in 1983 already. And of course, many more. And as Philips, we are transitioning. We're on a journey to become a health technology leader, and that requires some fundamental shifts. So innovation still remains at the heart of who we are and what we do, but we're shifting really from products, from technical products alone to selling solutions. So we like to build long-term relationships with customers and consumers and really target our products as solutions to solve actually problems that occur. And then, as such, we're making a shift from a technology company to a health technology company. And illustrating that as the healthcare continuum, we like to really view this as a continuum. It suggests basically the notion of continuous care. And we, as Philips, we want to deliver all these aspects. We want to be present. So in healthy living, going through prevention, diagnosis, treatment with home care, and eventually back into healthy living, hopefully. So, and these are the different domains within Philips that tie to these different aspects. So we're active in personal health, for instance, with Sonicare toothbrushes. We're in the diagnosis and treatment, an area that I'm going to discuss now, with precision diagnosis, image-guided therapy, and along basically all these different parts, there's connected care, basically connecting all the dots between sharing data, making data available to the patients and to the caregivers. In a bit more detail, well, precision diagnosis contains the CT, MR business, but also ultrasounds, for instance, X-ray. Also in diagnosis and treatments, we have image-guided therapy. So those are the interventional procedures, for instance, also X-ray guided interventions, and then connected care and personal health that I also discussed. And to give you a bit of an idea of how this, within this entire global Philips adds up, our diagnosis and treatment is takes the largest part of the group sales. So it's almost half of the sales come from diagnosis and treatment. About a third come from connected care, and then roughly a fifth comes from the personal health business. And then this was basically my introduction as Philips as a whole, and I'm going to switch gears completely to take you through a bit of the different types of jobs that are present within Philips before moving to my personal experience and the different roles I had within this company. Well, of course, we have on various layers in the whole product development cycle. We have different jobs with beginning in research, with hubs in Eindhoven, but also in Hamburg and in Cambridge near Boston. We have development sites, Best, Suzhou, Bangalore in India is a large one, where we do hardware development like gradient coils, magnets, but also software development, of course, so sequence programming, new ways of post-processing, user interface design. And then more towards basically the end product, we have clinical science. It's really in between all those categories, and I'm going to go into more detail there, but we have various roles. We have clinical scientists across the globe, basically at hospitals, and we also have than within the development organization. So to say, the best headquarters. And then we have application specialists that they act as the technologists, developing protocols, supporting sites, implementing new techniques that we have developed. And then finally, when we have a product, there's of course marketing is heavily involved. So my personal experience, and trying to start at the beginning, right after finishing off my applied physics in the University in Groningen, I immediately went to industry. Working at Philips as an MR methods programmer for about 3 years, really implementing new techniques. I've been working on arterial spin labeling, multi-echo acquisitions. But I soon realized that in my case, I was missing the view of the user. So I was missing how the clinical content, the clinical knowledge, how are the users using our systems, and I wanted to obtain more in-depth knowledge and really becoming the expert. So once the opportunity to perform a PhD and ultimately a postdoc at Leiden University Medical Center pops up, I switched from industry to academia. And there I really spent time mainly on 7 Tesla applications, getting them to use in the sort of the clinic or the research clinic, working on neurodegenerative diseases, but also epilepsy, supporting the fMRI research done there. Various topics, but really giving me the opportunity to become the expert on these topics, to really develop myself on how a radiology department works and how the systems are basically being used, before finally transitioning back to as a field clinical scientist at Philips Benelux. And I'm going into all these different switches a little bit in more detail on the next slide, but I first wanted to bring across what is a clinical scientist. So after my clinical scientist at Benelux, I was supporting local regional sites before switching really to a clinical scientist role in our development hub in Best, as focusing on neuroscience. And really, clinical science is bridging. It's the bridge between sales, marketing, and the R&D organization. So what we do is we provide research support. We support the clinical scientists that are located at hospitals. We are the internal clinical expert, so involved in road mapping, supporting marketing. We do educational presentations to customers, but also a lot of presentation actually educating our internal technical staff, and represent Philips at conferences and much more. So why all these switches? And then I've already touched upon those a little bit. Basically, my initial job at Philips was, of course, right after academia, right after basically finishing my master's degrees and just starting to work at a company. So soon realizing, indeed, as I said, that I wanted to have more clinical knowledge. And I obtained that in my PhD roles, but after almost 8 years in academia, actually I wanted to broaden my scope again in order to get grants, and it was also nicely illustrated by Bas. If you don't get grants, you're out. And I realized in order to get successful at grants, you need to be the super expert on a single topic. And I realized that's not what I wanted to be. I wanted to have a much broader role. I wanted to be not really focusing on a single topic and become super knowledgeable on that, but be much broader educated. So that's when I rejoined Philips, but then in a clinical science role, supporting the research hospitals in the Benelux region, and that's really supporting MRI at research sites at the hospitals that Philips works together as a research partner on all anatomies with different users, different hospitals. And this, of course, comes at the expense of less detailed knowledge, but it really gave me, in a few years, I've learned much more than I did at the end of my academic part, where I really had to focus on single, much more narrower scopes topics. After a few years, I did realize that I wanted to have a bit of again more in-depth knowledge, and that's when I rejoined basically the development organization again as a clinical scientist in neuroscience. And to me, that's the perfect balance, because it gets me to more in-depth knowledge, because I can focusing only on neuro and neuroscience. And in addition, it also gets me closer to influencing Philips's roadmap. So what are we going to do on neuro in the coming years? And what I really like about working in industry, and that's both for this role, but also for my previous roles, is that you work in a large organization. So there's a lot of knowledge internally. There's a huge network also globally with all the people working at hospitals and working at other locations. It's extremely diverse. It's not a single week is the same. And so if we look at my day-to-day job, as I mentioned already a lot of education, I do scanning and the coordination of external evaluations if we want to have new techniques evaluated at other hospitals. I do some prototyping, so also still program myself a little bit on sequences. Prepare documentation. It's a heavily regulated industry, so there's lots of documentation to be done for research projects, but also for commercial projects. I give courses, visit conferences, hospitals, and also do all the customer visits of the research hospitals that visit best. And that's also actually the large organization is also immediately a con, since it's not as fast as in a small team working in academia. It's a large organization, so it means there's a process for everything, and things can be quite slow. And the documentation requirements. I have to say that a considerable, significant amount of my time goes into making sure that all the documentation is in place. Well, I've been thinking, what questions did I ask myself, or should I ask myself when joining, and also if I see other people moving in from academia to industry, is that things that you can learn during a PhD that are also important when working in industry is that you need to be a self-starter, you need to be able to organize your own work. It's highly skilled work, so you need to be able to find things out for yourself. And especially working for a company, you cannot only focus on a single topic. So even if your PhD topic is not directly relevant to a new position, there's many transferable skills, of course, in your PhD that might be relevant for working at a company as well. So being able to find information, be able to work with different people, organization, designing experiments, communicating. So there's many of examples that you can think of. And as I noticed, especially for those roles really at the end, near the sort of the clinical implementation, it really helps if you have experience as an end user, or if you can at least think as a user, because basically every product that we design has to be used by the end user. And as that's really clinical experience is rated quite high actually also within Philips. So yeah, what drives me and basically most university programs at the bleeding edge of science and industry is, we are concerned also with science, especially within research, but always with the end having a robust and usable product, and sometimes that less high end than I would wish for, because it just needs to suit more different types of users. I'm definitely be more productive if I have short deadlines and a sense of urgency, and that's usually the case. There's only a few months a year that there's not a sense of urgency of something. And I really like it's a global industry, so you get to interact with many different people. I still interact with lots of scientists around the world that I enjoy very much. So I also enjoyed finally going back to a live conference in the last month again as well. And yeah, of course, it's heavily regulated. This is also already elaborated by Bas. Well, I probably must share this. If you're interested to work for Philips, the starting point to look at is careers.philips.com. You can search basically, even if you're not immediately interested, you can get a sense of what the types of jobs that are available there. They contain all the jobs that become available, will always be posted there. So from all the different divisions, including research, including MR. And there's also student internships. They're not that frequent, but they are occasionally there. So if you have a student, or if you are a student and you're interested, I would definitely recommend keeping an eye on that as well. And I think that concludes my my part of working for Philips and what Philips is.
Wonderful. Thank you so much for that overview, Maarten. It was great to hear about your journey and about kind of the pros and cons of industry versus academia, I suppose. And I guess if the audience has any questions, again, as we've been saying, feel free to pop in on the chat or unmute yourself. And maybe in the meantime, I can kick us off with one. I guess one question I often have about industry is like how much of a say you have over the type of work that you do, and maybe that changes as you spend more time in academia, but maybe if you could touch upon the intellectual freedom that you have at Philips and how that's changed relative to academia.
There's still a considerable amount of freedom on what to work on, but of course it's less than within academia. As a clinical scientist, I think that's probably the job that gives the greatest amount of freedom, since we're really a large part, I would say about 30–40% of my job is working with research hospitals and supporting them and taking up what basically they're developing and seeing if we can get that into our pipeline as well, if interested. So that gives me a considerable amount of freedom in which sites I work with and which I don't work with, and as long as it's within the scope of course, of what we're trying to do. Reality is, if I really want to make an impact, it helps if it's sort of aligned, of course, with our longer term strategy, and trying to move that is slightly more complicated because it's a large company and it involves many more people. Having said that, if you're fully in development, the freedom really to choose where you work from is much more limited, because then you're much more tied to projects that you're working on, and that's so the implementation and the technical skills are still, you can still spend a lot of your freedom in there, but the end result is sort of set. So it depends a bit on the role you have.
Thank you. Any other questions from our audience?
I do have another question. Well, first, maybe more a remark. I always figured that people who work in academia feel that they have the hardest job ever, that they have to make the most hours, that they basically have to work all the time for, well, the lowest salary, and like they have a really tough life. But from both of your stories, I don't really get the sense that it's easier working at Philips as a clinical scientist, or working or having a startup. So what is your experience? Is it, or can you not really elaborate on that? Is it easier in the industry or not?
I can try to elaborate on that. It's in a sense it's different. So where in academia, I think the biggest uncertainty, at least speaking for myself, was sort of the end of grants when you had to apply for new one. And I would certainly say that's much easier within working for Philips. Where within Philips, that part has been basically you don't have to worry about. You can of course you can always get fired, but initially I don't have a yearly or 2-year grant that I have to apply to. On the other hand, there's and maybe that's similar for it's in a way similar for academia, but there's larger projects that you're involved with, and the difficulty I find is that there's much more parallel projects that you're in. So there's always the juggling between really many different types of work almost that you have to do, and they all have their own deadlines that you have to work with, and I find that more challenging, shifting between one topic from the other almost constantly. You cannot work what I could do in academia, work for a couple of weeks on one end to really get into the details of something, or to finish off my paper, or to work on my data collection. Within Philips, it's always a couple of hours this, a couple of hours that, and that's more difficult.
Yeah, it doesn't sound really challenging indeed. But yeah, it's fun. I think it's fun. So yeah, thanks for the answer. It's a lot to think about.
Maybe I can also weigh in on your question. It's a good one.
Yeah, sure.
It depends a bit on your role, I guess, in academia. So if you want shorter days, then don't become a CEO. That's not a good idea. So for me, I think the hours even went up when I left academia. When you're working not at the board level, but are an expert employee in a company, it's probably slightly more relaxed because I think indeed funding, especially at larger companies, is more guaranteed. That's definitely true. And even for grants, so we do also apply for subsidies at the RVO, which is the pendant of NWO for businesses, funded by Economic Affairs. I think we got 90% of the grants we applied for. It's about 15% of our revenue we get from subsidies to do innovations. So the majority of the funding we get is from revenue, like classical selling of products. But we definitely do get grants. We actually are in a big one with Philips at the moment. So a nice bridge, the Signet project. Yeah, so I was really amazed how, well, maybe we got lucky or had really good consultants helping me out, but we almost got all of them. So that's something that I couldn't believe my eyes in the beginning, you know, how smooth that went.
Yeah, cool. And just maybe a little follow-up question, like the output for both of you is like an actual product, and you don't think in terms of papers anymore?
No.
That's maybe also very relaxed.
I once had a presentation a while ago on how I believe that the cycle of innovation is broken in science. Maybe I can sketch it briefly. So in science, and maybe because I always had a strong focus on methods also in my research, it always felt like, hey, you published this cool paper, and in the beginning for me it was really annoying, but after that you were supposed to do something else. But towards the end of your paper, your analysis, your code, everything worked perfectly. So it felt like waste to go and continue with something else. So that the company finally is much more satisfying because the paper, we still contribute to research and papers, is a start, not the end of something.
Yeah.
So that's a big difference. So basically the cycle of innovation goes all the way around until you go to market, get new funding and can do new research. So it's basically not half. And that's what's, well, for me personally, was one of the more satisfying things about going into innovative medtech.
Yeah, I can echo that. But it also made me realize that really the steps from having a working method in your lab and a paper is towards a commercial product is really long. And that can also be it could on the other hand also be the frustrating one. Initially, you think, well, we have all these nice things lying around. Why don't they get included? But if you really have to make it robust for many different users, it sounds like a no-brainer. But I was amazed how much work still needs to be done to go from an idea to a product.
When the paper is published, it's only a small part of the work. Then the real work starts. That's a bit maybe condescending to scientists. I don't mean that in a scientific way, but
no, I think I'm afraid it's true. Yeah. Okay. Is there any more questions maybe from the audience? There's none in the chat. No? Well, I think you're both going to be present in Glasgow, right? So if there is more questions, people probably know where to find you. So then the last thing is, I guess, to thank you very much. Maybe the very last thing is maybe we should take a picture of this workshop. So maybe if you want to be in the picture, turn off your camera, and otherwise feel free to don't be included in the picture. So let's do it. Let's just, for everyone who wants to be in the picture, turn on your cameras, then I'll make a screenshot. Elisa, can you do it as well? Just to be sure that I make the best screenshots. Let's do it like this. Okay, say cheese. Thank you very much. Well, thank you very much for attending this workshop, and I hope to see you all in Glasgow.
See you in Glasgow. Thanks for having me.
Thanks for having me, indeed.
Thank you so much for your contributions.
Bye-bye. Take care.
Bye.
Good luck.
Bye.